chronic inflammation usually doesn't present so easily clinically. And it's a chronic inflammation that is developing whether it's in our skin or joints or heart or brain. And that's the inflammation that is usually the precursor to almost all the diseases of aging. And just understanding that inflammation is often the beginning of these other we talked about sugar dysregulation, insulin resistance, prediabetes, diabetes. Inflammation is often the beginning of a disease process, whether it's Alzheimer's or heart disease or even cancer.
Health, fitness, mindset, nutrition. Live better and longer. I'm Saad Alam, and let's hone in. Everyone uses this catch-all term, inflammation. If you have inflammation, you're going to die sooner. If you have inflammation, your health span's going to be worse. What exactly is inflammation?
Right, so it's important to differentiate between acute and chronic inflammation. Acute inflammation is when you sprain your ankle or you cut yourself, it gets red, it gets swollen, and it can get itchy and hot. That's acute inflammation, which we all sort of know. Chronic inflammation usually doesn't present so easily clinically. And it's a chronic inflammation that is developing whether it's in our skin or joints or heart or brain. And that's the inflammation that is usually the precursor to almost all the diseases of aging. In fact, there's a term they now use called inflammaging, sort of the inflammation triggering aging. So tamping down the inflammatory process in the body is probably one of the best things you can do to sort of slow down the aging process. Decreasing sugar is probably one of the most important things you can do to slow down the inflammation. So you get the external triggers of inflammation, which could be not exercising, eating too much crap, the stress. All of that will lead, those external those triggers will lead to inflammation. But the internal inflammation that I'm obsessed about, and that's the gut. The gut is probably the commonest source or internal source of inflammation. So don't just think about the sugar and the meditation and the exercise. All important, the gut is a really important source of the inflammation. And just understanding that inflammation is often the beginning of these other we talked about sugar dysregulation, insulin resistance, prediabetes, diabetes. Inflammation is often the beginning of a disease process, whether it's Alzheimer's or heart disease or even cancer. A lot of people believe inflammation is where cancer starts. But, let's just take heart disease. It's not just about cholesterol and apolipoprotein B, which is more important than cholesterol. But it's you need that inflammation starting in the vessel wall, and then how the plaque will attach it. So think of inflammation as that first step in the disease process.
But I will tell you, the description of what inflammation does, and I think that the way you call it about inflammaging,
right?
It's on one hand incredibly prolific the way that you describe it. On the other hand, it actually really tells me that if there's one thing and one thing only that we are really trying to figure out, it's how do we stop inflammaging
exactly
as we're actually getting older.
So when you think of it, a lot of these techniques and modalities that we're recommending actually decrease inflammation in the body. So fasting, cryotherapy or cold plunging, exercise, meditation, sleep. All of these recommendations or these biohacks tend to decrease inflammation. So inflammation or inflammaging is that mechanism that most of them actually are or most of them are working by slowing down or decreasing the inflammation.